If you've been eating this vegetable thinking you're making a healthy choice, you need to hear this right now. I've had patients come into my clinic with severe digestive distress, bloating so intense they couldn't leave their homes, and gut pain that kept them awake at night. And when we traced it back, we discovered something shocking. A vegetable that's sitting in almost every refrigerator, considered perfectly healthy by most people, was silently wreaking havoc on their digestive system. What I'm about to share with you today could completely change how you think about this common food. I'm Dr. Helen Brooks, a gastroenterologist with over 15 years of clinical experience helping patients restore their gut health. I've seen hundreds of cases where people were doing everything right for their health, yet their digestive system was falling apart, and nobody could figure out why. Before we dive in, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. And if you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help more people just like you. Now, let me tell you about Margaret, a 68-year-old retired teacher who came to see me about 6 months ago. Margaret had always been health conscious. She ate what she thought was a balanced diet, walked every morning, and rarely touched processed foods. But for nearly 3 months, she'd been experiencing terrible digestive problems. She described intense bloating that started within an hour of eating, sharp abdominal cramping that would double her over, and such severe gas that she stopped attending her weekly book club meetings because she was too embarrassed. She'd lost 12 pounds, not from dieting, but because eating had become something she dreaded. Margaret had seen 2 other doctors before coming to me. They'd tested her for everything: celiac disease, inflammatory bowel disease, even cancer. Everything came back negative. She was told it was probably just stress or irritable bowel syndrome and was sent home with a generic diet sheet. But Margaret knew something else was going on. Her gut instinct, pardon the pun, told her there was a specific trigger. During our consultation, I asked Margaret to walk me through exactly what she ate on a typical day. Breakfast was usually oatmeal with berries, lunch was a large salad, dinner varied, but she always included vegetables. Then she mentioned something that made me pause. About 4 months earlier, she'd read an article about the benefits of raw vegetables for gut health. Wanting to be even healthier, she'd started eating large amounts of raw bell peppers, raw broccoli, and raw cauliflower every single day. She'd added them to her salads, ate them as snacks with hummus, and incorporated them into nearly every meal. This is where it gets interesting. For many people, raw cruciferous vegetables like broccoli, cauliflower, and even bell peppers, which aren't cruciferous but contain similar compounds, can be incredibly difficult to digest, especially in large quantities. These vegetables contain complex carbohydrates and fiber structures that our digestive enzymes struggle to break down when they're raw. They also contain compounds called FODMAPs, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. I know that's a mouthful, but here's what you need to understand. These are types of carbohydrates that don't get absorbed well in the small intestine. When these FODMAPs reach your colon, the bacteria there ferment them, producing gas, bloating, and pain. For someone with a sensitive gut or an imbalanced microbiome, eating large amounts of raw vegetables high in FODMAPs can trigger symptoms that feel like a serious digestive disease, when really, it's your gut bacteria going into overdrive processing food it can't handle efficiently. But here's what most people don't realize, and what shocked Margaret when I explained it to her. Cooking these vegetables breaks down many of these complex fibers and reduces the FODMAP content significantly. The same broccoli that causes terrible bloating when raw might be perfectly tolerable when steamed or roasted. It's not that the vegetable is bad for you, it's that the form you're eating it in matters tremendously. I put Margaret on an elimination protocol. We removed all raw cruciferous vegetables and raw peppers from her diet for 2 weeks. Within 5 days, her bloating decreased by about 60%. Within 2 weeks, her pain was almost completely gone. Then we slowly reintroduced these vegetables, but cooked. She could eat steamed broccoli, roasted cauliflower, and sautéed peppers without any issues. Her gut had been crying out for help, and all it needed was for these vegetables to be properly prepared. If you're still watching and finding this information valuable, comment a checkmark below to show me you're following along. Now, let me introduce you to Robert, a 72-year-old former construction worker who had a different but related story. Robert came to me with chronic diarrhea that had lasted for nearly 4 months. He'd been to the emergency room twice, convinced he had food poisoning or a parasite. All his tests came back clean. He was frustrated and exhausted, losing sleep because he had to get up multiple times each night to use the bathroom. Robert's diet history revealed something fascinating. His daughter, concerned about his health after he'd had a minor heart scare, had convinced him to start a clean eating regimen. Part of this involved drinking a large green smoothie every single morning. This smoothie was packed with raw spinach, raw kale, cucumber, celery, and sometimes raw cabbage. He was consuming the equivalent of about 4 to 5 cups of raw leafy greens every single day, all in liquid form. Here's what was happening in Robert's gut. Raw leafy greens, especially in large quantities, contain high levels of insoluble fiber. This type of fiber doesn't dissolve in water and acts like a broom in your intestines, which can be helpful for some people. But for Robert, whose digestive system was already sensitive, this massive influx of insoluble fiber was causing his intestines to move things through far too quickly. Add to that the fact that when you blend vegetables into a smoothie, you're breaking down the cell walls, which releases more of those FODMAPs I mentioned earlier, and you've got a perfect recipe for digestive disaster. There's also another factor that many people don't consider. Raw leafy greens contain compounds called oxalates. In moderate amounts, oxalates aren't a problem for most people. But when you're consuming several cups of high oxalate greens every single day, particularly if you have any degree of gut inflammation or if your gut microbiome isn't diverse enough to process them properly, these oxalates can irritate your intestinal lining. They can also interfere with mineral absorption, which is ironic because people often eat these greens thinking they're getting more nutrients, when in reality, they might be blocking their body from absorbing essential minerals like calcium and iron. When I explained this to Robert, he was stunned. He'd been trying so hard to be healthy, following his daughter's advice, and it was making him sick. We made a simple change. We cut his green smoothie consumption down to 2 or 3 times per week instead of daily, reduced the amount of greens to about 1 cup per smoothie, and started lightly steaming some of the greens before blending them. We also added cooked vegetables back into his regular meals. Within 3 weeks, Robert's digestive issues were 90% resolved. He could finally sleep through the night again. But if that surprises you, wait until you hear about what happened with Linda, a 65-year-old former nurse who developed what she described as the worst stomach pain of her life. Linda was meticulous about her health. She tracked everything she ate, took her vitamins religiously, and followed all the latest health trends. About 5 months before seeing me, she'd read about the benefits of fermented foods and raw vegetables for gut health. She started eating large quantities of raw sauerkraut, raw kimchi, and raw vegetables at every meal. She was also taking a high-dose probiotic supplement with over 50 billion colony-forming units. Here's where things went wrong. Linda developed intense abdominal pain, severe bloating that made her look 6 months pregnant, and such bad acid reflux that she couldn't lie flat at night. She went to the emergency room twice. They did CT scans, ultrasounds, and blood work. Everything looked normal structurally, but she was in agony. When Linda came to me, she brought a detailed food diary. As I reviewed it, I noticed she was consuming massive amounts of both prebiotics from raw vegetables and probiotics from fermented foods and supplements, all at the same time. What most people don't understand is that prebiotics are food for gut bacteria, and probiotics are the actual bacteria. When you flood your system with both simultaneously, especially if you do it suddenly and in large amounts, you can create a situation called small intestinal bacterial overgrowth, or SIBO. In SIBO, bacteria that normally live in your colon migrate up into your small intestine where they don't belong. These bacteria then ferment the food you eat, particularly carbohydrates and fibers, producing excessive gas right there in your small intestine. This causes intense bloating, pain, and digestive dysfunction. The irony is that Linda was trying to improve her gut health, but she was actually creating a bacterial imbalance by overwhelming her system. Additionally, all those raw vegetables, especially the cruciferous ones and the fermented foods, were high in histamine. Some people develop histamine intolerance, where their body can't break down histamine efficiently. When you eat a lot of high histamine foods, like fermented vegetables, and your gut is already inflamed or imbalanced, you can develop symptoms that include not just digestive issues, but also headaches, skin rashes, and even anxiety. We had to do a complete reset for Linda. We eliminated all fermented foods temporarily, dramatically reduced her raw vegetable intake, stopped the high-dose probiotic, and focused on cooked, easily digestible foods for 4 weeks. It was like watching someone come back to life. Her pain decreased within the first week. Her bloating improved dramatically by week 2. By week 4, she felt like herself again. Then we slowly, carefully, reintroduced fermented foods in small amounts and brought back vegetables, mostly cooked, in appropriate portions. What these 3 cases taught me, and what I want you to understand, is that context matters enormously when it comes to vegetables and gut health. The vegetable itself isn't the villain. It's about the form you're eating it in, the quantity you're consuming, the state of your gut microbiome, and how quickly you introduce these foods into your diet. Now let me talk about the specific mechanisms that make raw vegetables potentially problematic, because understanding this will help you make better choices. First, there's the fiber issue. Vegetables contain both soluble and insoluble fiber. Soluble fiber dissolves in water and forms a gel-like substance in your gut. It's generally well-tolerated and beneficial. Insoluble fiber doesn't dissolve and adds bulk to your stool. When you eat raw vegetables, especially in large amounts, you're getting a concentrated dose of insoluble fiber that your gut might not be prepared to handle. Cooking vegetables softens this fiber, making it easier for your digestive system to break down and process. It's like the difference between trying to tear apart a raw piece of wood versus one that's been soaked in water and softened. Your digestive enzymes and gut bacteria have a much easier time with the cooked version. Second, there are the FODMAPs I mentioned earlier. Vegetables like onions, garlic, asparagus, cauliflower, and Brussels sprouts are naturally high in FODMAPs. When you eat them raw, all of these compounds are intact and ready to ferment in your gut. Cooking reduces the FODMAP content, sometimes dramatically. For example, the FODMAP content in garlic can be reduced significantly just by cooking it in oil, because some of these compounds are fat-soluble and leach out into the cooking oil. Third, there are compounds called lectins. These are proteins that plants produce as a defense mechanism against being eaten. Lectins can bind to the lining of your gut, and in some people cause inflammation and digestive distress. Cooking destroys or deactivates most lectins. This is why you should never eat raw kidney beans. They contain extremely high levels of lectins that can make you very sick. But even vegetables like tomatoes, peppers, and eggplants contain lectins that, while not as dangerous as those in raw beans, can still cause issues for people with sensitive guts, especially when consumed raw in large quantities. Fourth, there's something called anti-nutrients. These are compounds in plants that can interfere with nutrient absorption. Oxalates, which I mentioned with Robert's case, are one type. Phytates are another. These compounds bind to minerals like iron, calcium, and zinc, preventing your body from absorbing them. Cooking reduces the levels of these anti-nutrients, making the nutrients in the vegetables more bioavailable to your body. Now, I want to be absolutely clear about something important. I am not saying that raw vegetables are bad or that you should never eat them. Raw vegetables can be wonderfully nutritious and beneficial for many people. What I'm saying is that more is not always better, and raw is not always superior to cooked. Your gut health, your microbiome diversity, and your digestive capacity all play a role in how well you tolerate raw vegetables. Let me tell you about Thomas, a 70-year-old retired accountant who illustrates this point perfectly. Thomas had always eaten a moderate amount of vegetables, both raw and cooked, without any issues. But after his annual checkup, where his doctor mentioned he should increase his fiber intake, Thomas went overboard. He started eating huge raw salads 3 times a day, snacking on raw carrots and celery constantly, and drinking vegetable juice every morning. Within a month, Thomas developed chronic constipation, which seems counterintuitive given all the fiber he was eating. But here's what happened. He was consuming so much insoluble fiber so quickly that his gut couldn't produce enough digestive juices and enzymes to process it all. The fiber was actually binding together and moving too slowly through his system, creating a traffic jam in his intestines. When Thomas came to see me, he was miserable and confused. How could eating all these healthy vegetables make him constipated? We scaled back his raw vegetable consumption significantly, introduced more cooked vegetables which are easier to digest, and made sure he was drinking plenty of water, because fiber needs water to move through your system effectively. We also added some healthy fats to his diet, because fat helps stimulate digestive secretions and keeps things moving smoothly. Within 2 weeks, his constipation resolved completely. There's also the issue of gut motility and age. As we get older, our digestive system naturally slows down. We produce less stomach acid, fewer digestive enzymes, and our intestinal motility isn't as robust as it was when we were younger. This means that foods we could easily digest in our 30s or 40s might become problematic in our 60s and 70s. Raw vegetables, with their tough fiber structures and complex carbohydrates, become harder for an aging digestive system to break down. This doesn't mean you have to give up raw vegetables as you age. It means you need to be more mindful about the types you eat, the quantities you consume, and how your body responds. Some people do beautifully with raw vegetables their entire lives. Others need to adjust their approach as they get older. Let me share one more case that brings all of this together. Patricia, a 69-year-old former librarian, came to me with what she called unpredictable gut attacks. Some days she felt fine. Other days, within an hour of eating, she'd develop such severe bloating and cramping that she'd have to lie down for hours. She couldn't figure out the pattern. She'd kept food diaries, tried elimination diets, and nothing seemed to make sense. As we worked together over several weeks, a pattern finally emerged. Patricia's gut attacks always happened on days when she ate raw vegetables with certain other foods. For example, if she ate a raw salad by itself at lunch, she was usually okay. But if she ate that same salad after eating a big sandwich with bread, she'd have terrible symptoms. Or if she ate raw vegetables alongside beans or lentils, she'd inevitably feel awful afterward. What was happening was a compound effect. The combination of the fiber from the raw vegetables plus the complex carbohydrates from the bread or legumes was too much for her digestive system to handle all at once. Each food alone was manageable, but together, they overwhelmed her gut's capacity to break down and absorb everything efficiently. The result was excessive fermentation, gas production, and pain. We restructured Patricia's eating patterns. She started eating smaller, more frequent meals. She separated her raw vegetables from her heavier carbohydrates, eating them at different times of day. She also reduced her raw vegetable portions and made sure to cook cruciferous vegetables rather than eating them raw. The transformation was remarkable. Her unpredictable gut attacks became rare and mild when they did occur. What I want you to take away from all these stories is that gut health is incredibly individual. What works beautifully for one person might cause significant problems for another. The key is learning to listen to your body and understanding the science behind why certain foods might affect you the way they do. So what should you do with this information? First, pay attention to how your body responds to raw vegetables. If you notice bloating, gas, cramping, or changes in your bowel habits after eating raw vegetables, especially raw cruciferous vegetables like broccoli, cauliflower, cabbage, or Brussels sprouts, try cooking them instead. Steam them, roast them, sauté them, but give your gut the advantage of pre-digested fiber. Second, don't go from 0 to 60 with raw vegetables. If you're currently eating mostly cooked vegetables and you want to add more raw ones to your diet, do it gradually. Start with small amounts of easier-to-digest options like lettuce, cucumber, or zucchini. See how your body handles those before moving on to tougher vegetables like raw kale or raw broccoli. Third, consider diversity in your approach. There's no rule that says you have to eat vegetables only raw or only cooked. Mix it up. Have some cooked vegetables at one meal and a moderate amount of raw vegetables at another. This gives you the benefits of both, the intact enzymes and certain vitamins in raw vegetables, and the easier digestibility and increased bioavailability of nutrients in cooked vegetables. Fourth, if you're taking probiotics or eating a lot of fermented foods, make sure you're not overwhelming your system. More is not always better. A moderate amount of fermented food, like a few tablespoons of sauerkraut or kimchi a few times a week, is usually beneficial. But eating large quantities daily, especially if you're also consuming lots of raw vegetables and taking probiotic supplements, can create an imbalance. Fifth, drink plenty of water. Fiber needs water to do its job effectively. If you're eating a lot of vegetables, raw or cooked, make sure you're staying well hydrated throughout the day. Sixth, chew your food thoroughly. This is especially important with raw vegetables. Chewing breaks down the tough cell walls and starts the digestive process in your mouth. The more thoroughly you chew, the easier the job is for your stomach and intestines. And seventh, if you're experiencing persistent digestive issues despite making these changes, please see a gastroenterologist or a healthcare provider who can evaluate you properly. Sometimes digestive symptoms that seem related to diet are actually signs of underlying conditions that need medical attention. Don't suffer in silence or try to self-diagnose indefinitely. I also want to address something I see frequently in my practice. Many people feel guilty or like they're failing at being healthy if they can't tolerate large amounts of raw vegetables. Please hear me when I say this. There is no one-size-fits-all approach to healthy eating. Your gut microbiome is as unique as your fingerprint. What works for the influencer you follow on social media, or what worked for your friend, might not work for you. And that's completely normal. Health is not about rigidly following rules or forcing your body to adapt to a diet that makes you feel terrible. Health is about nourishing your body in ways that make you feel energized, comfortable, and vibrant. If that means eating mostly cooked vegetables instead of raw ones, that's perfectly fine. You're still getting incredible nutrition, fiber, vitamins, and minerals. You're not missing out on anything essential by cooking your vegetables. In fact, some nutrients become more bioavailable when vegetables are cooked. Lycopene in tomatoes, for example, is much more absorbable after cooking. Beta-carotene in carrots increases in bioavailability when they're cooked. So the idea that raw is always better is simply not supported by the science. Now, before we wrap up, I want to make sure you understand that if you're currently experiencing gut issues, please don't ignore them. Don't assume it's just stress or something you have to live with. Your gut is trying to communicate with you, and persistent symptoms deserve proper evaluation. Book an appointment with your doctor. Keep a detailed food and symptom diary. Be an advocate for your own health. And remember, small changes can make enormous differences. You don't have to overhaul your entire diet overnight. Start with one simple modification. Maybe it's cooking your broccoli instead of eating it raw. Maybe it's reducing the size of your daily salad. Maybe it's eating your vegetables at a different time of day. Make one change, observe how your body responds, and adjust from there. Your gut health affects everything from your immune system to your mental health, from your energy levels to your sleep quality. Taking care of your digestive system is one of the most important things you can do for your overall well-being. And sometimes, taking care of your gut means cooking that vegetable instead of eating it raw, even if raw seems healthier in theory. I hope this information has been helpful and eye-opening. If you found value in this video, please give it a thumbs up and consider subscribing to this channel. Share this with anyone you know who struggles with digestive issues or who's been overdoing it with raw vegetables thinking it's always the healthier choice. And please, leave your questions and experiences in the comments below. I read every comment and they help me create content that truly serves you. Remember, health is a journey, not a destination. Be patient with yourself, listen to your body, and don't be afraid to adjust your approach based on what makes you feel your best. Your gut will thank you for it.